Welcome everyone, my name is Dr. Tom Chaney from Living Health Integrative Medicine in Annapolis. In today's video, I'm going to go over the top 15 causes that we see for type 2 diabetics in our office. So one of the things when we're looking to reverse a patient's type 2 diabetes, what we want to address is the underlying root causes of the disease. So I'm going to go over the top 15, and then in upcoming videos, what I'll do is I'll break down these top 15 and kind of get into more details on each one of them. So let's start with number one. We're going to start with food sensitivities. So one of the things that we do in our office is we'll do food sensitivity testing, and we use that as a tool to customize a nutrition plan for a patient in our office. So that's number one. Number two is gut health. Your gut and the health of your gut plays an important role in helping to regulate sugars. I'll get into more details on that in the future. Inflammation. So a lot of inflammation with our patients coming in, and we have to get inflammation down because it's definitely going to have an effect on blood sugar. Your sex hormones, we all know hormones are important, and yes, they do play a role in blood sugar regulation. All right, next one, anemia. So we got to look at any anemias and get those corrected and cared for properly. Toxins. Toxins are definitely going to affect blood sugar regulation. It's going to increase your insulin resistance, so we're going to talk about that and go over some research. Pancreas function, of course, you know, most of the time when patients come in and they're type 2 diabetic, they think that they have a problem with the pancreas. We're going to talk and kind of distinguish and go over that in more detail because there is a lot of confusion. So we do look at pancreas function, but I can tell you that is usually not a top issue and top cause, but it could be. Vitamin deficiencies. Many of the prescription medications that type 2 diabetics are prescribed will cause vitamin deficiencies, which can make this disease worse, so we need to look at that. Stress. So mental emotional stress for sure plays a role in blood sugar regulation and does have an effect on your blood sugar, so we'll talk more about that later. Your thyroid. So thyroid gland sits right in the front of your throat and runs your metabolism. So of course, if it runs your metabolism, it's going to really dictate how fast or how slow you're burning sugar. Insulin resistance, I mentioned insulin resistance. We're going to get into details about what insulin resistance is. I know a lot of diabetics, they come in and they've been told they have insulin resistance, but they're not really sure what that is. Adrenal dysfunction and cortisol issues. So cortisol is a hormone produced by the adrenal gland. So we definitely test for the adrenal glands because cortisol can have an effect of elevating blood sugar, so we're going to look at that. Mitochondrial dysfunction. So the mitochondria of the cells are the powerhouse of your cells. So they're really going to dictate how fast or how slow you're burning sugar and your energy production as well. So we're going to discuss more about mitochondrial dysfunction. The next cause, infections. So I see patients that come in with parasitic infections, bacterial infections, viral infections, mold infections. All of those definitely affect your blood sugar, and I'm going to talk about why in later videos. And then liver dysfunction. So you mess with the liver, you're going to affect blood sugar. And I'm going to get into that and go into the details of that in the next video. So I hope you guys got some good information out of today's video, and we'll cover each one of these in follow-up videos.